The elections for the regional office of the World Health Organization will take place here in Delhi. Now, this is the Southeast Asia office director post and one of the most important posts in the World Health Organization's hierarchy. With me is one of the candidates, Saima Wazed. Ma'am, welcome to WION. My first question to you is how hopeful you are of your win during this election that will take place here in the Indian national capital.
Firstly, thank you so much for having me here. It's really a pleasure to be here. As for how hopeful, I've had a lot of positive feedback. I have made many opportunities over the last year or so, last 2 years, been to many of these countries. Some of these ministers have been there for a long time, and I've worked with many of them and the ministries with my work with mental health and autism, and they have always been very positive interactions. And of course, once the campaign has started recently, my engagements with them were very positive. So their commitment is steadfast, and on top of which Bangladesh has very good bilateral relationships with these countries. We've been mutually supportive of one another throughout, particularly dealing with the pandemic and over many other issues in our region. Bangladesh plays a very important role and has been a supportive country to many of them. So I am hopeful at this time. Ultimately, of course, it is a very important decision for each of our countries. There are many implications, long-term implications in a very important issue with our health. So I hope that they will make a good decision and they will choose me. So one of my priority areas of work is mental health, and that is a priority for them as well. So I'm fairly hopeful, yeah.
Ma'am, your work in autism is well known. If you can elaborate about your work in that field so that our viewers can get to know more about you and your work.
Well, I started in the area of, I'm a school psychologist. I was a clinical psychology professional before that, and I've been working, specialized in autism as in addition to my typical work in school psychology. I used to work in the public school systems, and I became involved in a larger scale as far as advocacy and policy development around 2009, 2010. Met with many of the parents that were in our country, had the opportunity to join forces with the UN sort of World Autism Awareness Day events and other NGOs, as well as the World Health Organization, and we organized the Global Autism Public Health Initiative and the Southeast Asia Autism Network formation with a conference that we organized here in Dhaka in 2011. So my work in the area of autism goes back pretty much from my professional career. It's been an area of interest, but it has evolved from just simply doing assessment and intervention planning for individuals and working with families directly into the larger sort of country level policy, into the global advocacy, and I've used that experience to coming from a very set system, very Western system, and how to adapt that into our realities of shortage, where we don't have the health professionals, we don't have the education specialists, we don't have the parent training, we don't have school systems that have good support, or even the very thorough laws in Bangladesh and even in our region. So I have taken my education, my learning, and evolved it into working for what would be suitable for our country and our culture and the realities of the challenges that we all face. My belief with and particular interest in autism is that it is such a wide spectrum of need, from individuals who are very highly functioning, who can be very independent, who are very productive, to those who have complicated, complex needs from a health perspective, from a life perspective, and families that are in desperate need of support. So it's very multifaceted, very complex, and to take that complex medical condition, so to speak, and not just address it from like just a social sort of like, we'll give them some little bit of support to actually help my country develop policies and programs that ensures greater equity, that ensures more opportunities for them to be, integrated into the social fabric of our system. So it has been a huge challenge because the tremendous stigma that families and individuals face whenever they have any kind of disability, the taboo that we have culturally in our region, in fact, is of, we all know that it's tremendous. It's very difficult to understand, and just having laws and policies aren't enough to really change people's attitudes and people's beliefs, and that has been the primary focus. Because if you cannot change the attitudes and the beliefs that people have towards somebody with a disability, somebody with an autism spectrum disorder, somebody with a mental health condition, that stigma that exists within the family takes away 90% of any effect, any treatment, any support service you can have, because you're sort of looked down upon, or you're misunderstood, and you're not accepted, right? So coming from this whole huge dream to have a fantastic service provision, to seeing the reality that you have to change how people think and believe. The biggest challenge is that making people think differently, believe differently, and that's where I come from, and that's where true change needs to come. I firmly believe in inclusion of people. I believe that everybody, regardless of what strengths or weaknesses they have and how we've labeled or decided as health professionals to give them a diagnosis, they're people. They have fantastic qualities within them. They have skills with them. They have people that love them. They're a part of a family. They're part of a society, and they should be treated with equality. Their human rights should be appreciated. They should be accepted. We should treat them not just with kindness. We should accept them as they are and be able to communicate with them the way they need to communicate. And so that has been my philosophy and what I've been working on. And I know it's going to constantly be an endless job, because like I said, in our part of the world, the stigma and taboos that exist, we strive for perfection, and we value education, and we value very important careers. So having any kind of learning difficulties or communication difficulties, or not being able to be perfectly engaged or not look perfect and present perfectly, is always going to be very stigmatizing. So it's going to be an ongoing work, and that's the philosophy I come from, is complete social inclusion and acceptance of people as they are, and ensuring that we are a much more compassionate and kind society. So to that end, I've approached it from a point of view of certainly advocacy, but not just advocacy at one point, advocacy within the family for individuals, advocacy to the society at large, to their community, advocacy to policymakers. And so my work has gone from advocacy to policy development, because if you need the right laws and policies in order to ensure that services and programs are comprehensive. In Bangladesh, we developed a national strategic plan for autism, And the strategic plan is very, very comprehensive, and it encompasses like 18 ministries that's embedded within that they can do. So if you're building roads and highways, you're in charge of, you will. So you would think that they won't be involved in something like autism, but yes, they are, because when somebody wants to hold some kind of an event that ensures awareness or deals with awareness, they need permission from the city council, or they might need permission from some government department that's under that ministry. So we've chalked out all of this information and put it into a strategic plan. And those are, achievable goals. Those are maybe, some are long-term, some are short-term, but they're there so that each ministry can look at what is doable and manageable for them, and they can begin implementing that. Again, these are ideas, and there are going to be ways to monitor it, ways to measure it, and how to implement it. And these are going to be learning experiences, because it's a very new approach, and these gaps exist in many countries. So the fact that we have something that comprehensive is informed by research data that exists. It's informed by people with lived experiences, and I'm proud that we developed that as a team, and it was a huge learning experience, because as much as you have things on paper, it's not always possible to implement every single one, and that so many challenges still exist. As we worked on developing the policy, I had my organization, we also developed resource materials, because we realized there wasn't the same kind of content that we needed that's reflective of what's needed in our country. So we've had training programs and such and so forth. Yes.
So a lot of work there, ma'am, but essentially, if we will see you there as the director of the World Health Organization's regional office, the Southeast Asia office. What will be your key aims? What are the plans or visions you are expected to put in place as the director of this key office of the World Health Organization in the region?
Well, I see the World Health Organization as an expert organization that supports our country's health infrastructure. And in order to have a good health infrastructure, it has to be inclusive of these various groups that are doing. We have so many health issues and health challenges that we have to also address the communicable diseases. We have to address growing issue of non-communicable diseases. We have to, deal with antimicrobial resistance. We have to deal with workforce shortage. So there are complex issues that we're constantly having to deal with. But my real goal is to ensure that mental health, which has been sorely neglected and is a huge challenge, is incorporated within the entire health system. And again, marginalized groups, so those with these kind of complex disorders, those who are socially and culturally marginalized, groups that have in many ways been neglected because we haven't always understood exactly how the health need work. Like, so for example, women's health has always been very neglected within the medical health professional, particularly because so many women supported women, but they didn't really have the medical treatment, so to say. So ensuring those core issues are within this health infrastructure that our countries and our region develops is going to be my primary goal. And I see that working sort of parallel and working side by side with many countries as well as with the WHO, I've realized that there are many commonalities, many challenges within our countries, but along with the many differences, we have some similarities. But when it comes to our health area, we need greater cooperation and collaboration. We need to have partnership among our countries. There's great diversity in what is available in one country versus another. And if we don't have greater partnership among countries that WHO can facilitate, then certain countries will always, their health systems and health structures will always be, will fall behind. And, every country cares about the people. We want our region, we want our people to be healthy. So what I want to do as regional director is ensure that I can facilitate that, because being a regional director gives me the opportunity to have that neutral position and be available for every one of those countries to do so. Facilitate cooperation, greater partnership and collaboration, so that every country at least has universal health coverage and quality, equitable health coverage across that, and that we share some of these resources and resource development planning that we feel is strongly needed. So that's what I would like to do as regional director.
Ma'am, there was an early indication that India is going to support your bid. We saw the joint statement of March 2021 when the Indian Prime Minister Narendra Modi travelled to Dhaka. How do you see Indian support for your candidacy?
Well, India was certainly one of the first countries when Prime Minister Modi had visited Bangladesh, and we had just announced informally that I would be the candidate. He had expressed support for Bangladesh, and I'm happy to say they have been steadfast in that. I think they see an opportunity that, for Bangladesh, given how well we have done in our health sector. So I'm happy to say that that support has been firmly there. I know for a while there was some questions that were created and so, but I think that India has been steadfast. There are many sectors India and Bangladesh have worked together to address, and health has been one of them. So India has been steadfast with us.
Ma'am, like all elections, there is a bit of controversy as well. Some of the candidates who are in the fray have made certain remarks which you might have seen as well, and there is a political link as well. You're the daughter of the Prime Minister as well, Prime Minister of Bangladesh, Sheikh Hasina. So, ma'am, how do you see these comments as, and of course, the comments on your political linkages and your candidacy?
Yes. Well, when I was born, I was the granddaughter of the father of the nation, Sheikh Mujibur Rahman, So I have always known who I am, and I know that there will always be a reminder of that. But I was also raised as a refugee. I was also raised by a mother who had lost everything overnight. And so how we were raised and how my brother and I were brought up is to learn to stand on our own feet, work hard at what we have to do, and at any given point that could be taken away. So make something of yourself and find a way to contribute to your country. And that is all I have been doing. The first opportunity I had as a professional, as a psychologist, to give something back to my country, I have taken it. So, being criticized for being somebody's daughter and it's a little bit laughable for me, because I am who I am. I was her daughter when she was in opposition. I was her daughter when being a politician's daughter wasn't that great as a teenager. In a boarding school, it wasn't the best thing. So, and now, of course, she's a successful prime minister. So that is also something I have to deal with. But I really don't give it much credit. I know I have many more opportunities, certainly, to meet people perhaps that I would probably not have, but I have worked hard for my country. I've worked hard for the region, for cause that I believed in, and I'm very appreciative of all the help and support people have given me to get here. But I know that I have learned the hard way and worked hard at it, and I want to continue to be able to do that just like any other professional. So yes, it really doesn't matter to me what assumptions people will make. When you're the daughter of somebody very, very big and very successful, everybody assumes that things are much easier for you, but you don't get to be successful unless you work hard. So if you're the child of somebody who works very hard, you have to work extra hard to meet their standards. So yeah, the fact that she was appreciative of and recognition, it means a lot more to me than any other criticism that's out there.
Ma'am, before I let you go, my last question to you is, you're also the chairperson of the International Jury Board meeting of UNESCO for Digital Empowerment of Persons with Disabilities. Now, digitization is something that has been the focus here in India, in Bangladesh and other countries of the global south. So how do you plan to, if you get to this post, to make sure use the digital infrastructure of the countries to make sure that healthcare is able to be given to the person at the bottom of the ladder?
Well, I think the digital platform is a tremendous opportunity. The advancement that has been made from training health workforce to bringing treatment methods, even surgery, and connecting with specialists all the way across the world, all of those things can be brought into our region. And that advancement that has been made, I want to be able to take advantage of those advancements within the digital health system and other resources, and make sure, particularly for our region, where we have people who are living in very remote, inaccessible areas, where we have a shortage of specialists, where we have a shortage of people aren't always as well informed or have information available to them. So there are many, many ways that the digital system can be utilized. There are many resources that are there, even in the research phase, that can be adapted. Our country, our region has most densely populated region, so we can not just use what has been developed, but help pilot newer methods and make sure that the digital platform, when it comes to the health system and health workforce development as well as service development, that can be used as a way to create even better methodologies that perhaps other countries could utilize. Because when you're using something and you find it usable in a challenging situation, then other countries that have it could learn from that and perfect it even more. So our region could then actually be a way to further evolve the systems that exist. I know in Bangladesh, we've done information dissemination. We do training of health workers and health workforce at various levels. We've even done mental health services where the specialists in Dhaka are actually using providing assessment and intervention strategies for people living in very rural areas. So guiding treatment, it would ensure that there is less mistakes in treatment, because we do have a strong lack of specialists. So using this platform, there are many opportunities, and I think it would enable greater well-being and better health for everybody in our countries, particularly those who are less able to get to tertiary care centers. So and having, again, using it as partnerships to develop the health workforce and information dissemination. Data can also be used very easily, much more easily, and ultimately it's much more cost effective, so it'll be more sustainable, financially feasible for countries.
Well, thank you so much, ma'am, for speaking to WION. It was lovely speaking to you, and hopefully we'll see you here in Delhi, perhaps before the election. Thank you so much, ma'am.
Thank you for having me.
Thanks, ma'am.